Hello, everyone, and welcome to today's virtual talk. My name is Katerina, and I work as a health educator in the Patient and Family Resource Center as part of our patient education department at the Seattle Cancer Care Alliance. I'd like to introduce our guest speaker today, a former SCCA employee and one-of-a-kind nurse practitioner, educator, teacher, and our friend, Leslie Heron. A little bit more about Leslie is that she has over 35 years of nursing, family practice, and nurse coaching experience. She works with individuals, community, and professional groups in clinics, classrooms, at conferences, through retreats, and online. Currently, she does much of her work in the areas of cancer survivorship and healthcare provider wellness. Leslie lives in Mount Baker foothills in Northwest Washington State. She co-founded the Green Labyrinth, a rural retreat center with a mission to provide sacred sanctuary for family and professional caregivers addressing grief, loss, and burnout. If you would like to learn more about Green Labyrinth, please visit www.green-labyrinth.com. We'll review this at the end as well. And to wrap up today's talk, I will share some of Leslie's recommended resources and more ways to get in contact with us. Leslie, thank you so much for joining us today.
Well, thank you, Katerina. Thanks so much for having me. And I have to say, this is one of my favorite topics to talk about. And I really appreciate that my former colleagues and all around terrific people in the Resource Center at SCCA have asked me to talk about sex and cancer. So our talk today, the title is Do Ask, Do Tell, Sex and Cancer. And the reason for that is that we know by research that patients have questions and issues and concerns about sex and sexuality during and after cancer treatment, but they're kind of afraid to bring it up. And also our healthcare providers, our doctors and nurse practitioners and PAs and everybody know that people have sexual side effects with cancer and after cancer treatment. It's well documented. There's lots of research on that, but it doesn't seem to be like the first thing on the agenda that we bring up when we're talking with patients. And we know that doctors and nurses say, well, if the patient was having concerns, they'd ask us. And the patients say, well, if it was normal to be having these side effects, certainly my healthcare providers would talk to me about it. And so everyone is kind of sitting there in the room waiting for the other person to bring this up. So our talk today is titled Do Ask, Do Tell, Sex and Cancer, because we want you to bring it up and we want you to know that it's normal and that there's things that you can do to get help with this issue. Okay. Sorry about that. I had to figure out how to advance my slides. So sex and cancer, right? Not a real desirable combination. You know, we wouldn't usually put these two words together in the sentence like, ooh, boy, you know, sex and cancer. Yeah, that's a good thing. But when you don't have a choice, at least you know that you've got some resources. I'd like you to be thinking about these things as we go through this talk, just so that you're aware of the terms and the way that I'll be using them, and also maybe some terms that you could bring up when you do ask and do tell. So sexuality is what we think about as how we perform and how we feel sexually. Sex is usually kind of the act or the physical components of sexuality. But they can be used interchangeably, and both those words are okay to use. Intimacy, I think, is something most people feel, that feeling of closeness, that feeling of belonging. Even if they aren't having sex with a partner, they could still feel intimate and still feel good about that. So it isn't always about kind of the act of sex or the performance of sexuality, but also that intimacy that we're going to be talking about today, even though our title is Sex and Cancer. So all of these are normal components of life before cancer, during cancer, after cancer. It feels a little more remote, probably during and after. And that's what this talk is about, just to encourage you to think about these things as being normal parts of being human, normal parts of being alive, and how can you get some help with those if you need it. So these things can be hard to bring up, but we're going to do it anyway, okay? Do ask, do tell. So what are these common sexual side effects with cancer? I want you to think about this as, maybe even before you were diagnosed with cancer, or before your partner was diagnosed with cancer. There might have been just, feelings of fatigue or not feeling so terrific. And, but then we go through cancer treatment, right? And it can be surgery and chemotherapy, radiation therapy, immunotherapies, all those different things. And just the stress and anxiety that goes along with all of that. But so what are those side effects that are really common that relate to sex and cancer that most of the time we don't talk about? So there can be sensitivity changes, and this can be, you can think about on your skin, on your body, maybe an area that used to be love being touched, now is numb or dull because there is maybe a scar there or something. Or maybe it's really hypersensitive, and that little gentle touch that used to feel so good is like, don't do that. Or maybe with that numbness and dullness, that gentle touch doesn't even register anymore. That's very common. Hormone changes, certainly with this, so many things happen with hormone changes. We can get decreased libido. We can get vaginal dryness or erection problems, hot flushes that affect sleep and attitude, things like that, mood swings, weight changes, and body mass changes. Strong muscle kind of gets a little bit more soft and jingly with different hormone changes. These can be hormone changes that happen because of chemotherapy, maybe more sudden menopause change, or it can be caused because there's actual hormones being given to you or your partner to help combat the cancer itself. Body image, and this is huge, and it's hard. We don't often have a lot of words around body image changes, but this is something that where you just don't feel like yourself. Like, oh, you look in the mirror and you're like, oh, who is that, right? So ports and lines, surgical changes, and those can be inside surgical changes where maybe with something like a hysterectomy, where a woman might have really been thought of themselves as being kind of this mother figure, and maybe with a hysterectomy, when the uterus is removed, they're saying like, oh, I just don't feel quite as womanly now, and that's common. So that can be an inside change that can't be seen, or it might be an outside change like scars, hair loss, weight changes, and there's that feeling overtouched, like your body really doesn't belong to yourself. It kind of belongs to the medical people that are poking and prodding it all day long. Lots of different things that can go on kind of in our minds around body image. There's physical function as well. Certainly things like dry mouth, kissing is just not quite as exciting when you have a dry mouth. You might feel weak or have pain on the body, might be pelvic pain specifically. There can be urine leakage and bladder function problems, maybe more urinary tract infections, bowel changes like constipation or having lots of loose stools aren't feeling very sexy, right? Erection problems, with hard to get an erection or hard to keep an erection. atrophic tissues. And what atrophy or atrophic tissues mean is the skin in some areas, might be the mouth, might be the vaginal area, is dry, might shrink a little bit, might not be as stretchy. So it's more uncomfortable to have touch or intercourse or sensations. And it's just might even be hard to be sexual in the same way that you used to be. Then that could be positioning. It's harder to lay on your back or harder to lay on your side. It might be not having the stamina that you used to. Those kind of things, just those physical changes that are kind of like, we'll put it off. Fear can be a component too. There's the fear of safety with sex. And I have to say, we healthcare providers are the worst with this. We tell you all the things you can't do, but we don't often tell you the things that you can go back to doing. So if your blood counts are low, or if you're at increased bleeding risk, and we're like, oh, no sex for you, we're very unaware enough to go like, oh, your blood counts are okay now, or you're not on that risky chemotherapy. You can touch again, you can kiss again. There's also fear of pain. If there are some of these dryness or not very stretchy tissues or the hypersensitive areas, there can be fear of rejection. What if I don't perform very well? Will that be bad? And fear of failure. Really, and we see this an awful lot of someone who maybe can't get to orgasm or can't get a full erection anymore, and it's just easier to avoid than it is to give that a try and try something new or different. It's taking a risk. Stress. Oh, how often do you be like, oh my gosh, I've got a big deadline, and bills are due, and I've got 14 things on my to-do list. Ooh, let's have some sex, right? That's always top of the list. So that stress level that comes along with having cancer, going through treatments, feeling distracted, anxious, worry, and decreased confidence really can come along with that. Energy levels, certainly. There was some researchers who looked at people talking about sex and cancer, and one person said it would be like wanting to have sex while you had the flu. And so, it's like, yeah, that doesn't sound that sexy. But feeling fatigued, if you're really not getting good sleep, if you just don't feel very creative, you haven't got a lot of attention to be like, yeah, I'll plan that for later. That can really make a big difference. So I've got a couple stories to tell you, just to know that this is normal. It happens all the time, but there's things that we can do. So I had an older couple come into the survivorship clinic when I was working for Seattle Cancer Care and Fred Hutch. And this gentleman who came in had had prostate cancer a number of years before. He and his wife both came into the survivorship clinic to go over his history of cancer and what he might want to do to be proactive moving forward. And as we kind of got through talking about different things, I brought up intimacy and sexuality and said, so how is your sexual function? And this patient said, it's fine. And I saw his wife kind of out of the corner of my eye go, and I thought, okay, there's a story there. So I said, do you want to chime in on this one? And she had been chiming in throughout, like, oh, his energy level this, or no, he's doing really great with that. And she's like, we used to have sex all the time. I know we're older, but we were very sexually active. And I said, and how about now? And she said, he just goes out to the garage and works on projects. And so I, asked him, what do you think about that? And he says, she's right. And he said, I'm really afraid that I my erections aren't very hard. I don't, I can't maintain them for very long. I feel really embarrassed about it. And the two of them then kind of had this great conversation together. And it's so funny that, or not funny, but it's funny that they had been both thinking this and both wanting to get back together, both wanting to be more intimate together, but they just had not talked about it. They had just drifted apart. And so after they had a little bit of a conversation, I joined in and I said, well, what kind of things would you like to try? What have you tried in the past? What worked for you before? And we had just a very simple conversation. And the two of them were just like, you know what? We could talk about this more. We could work on this. And it was so funny to see them probably, I don't know, 6 months later. I just happened to see them at a survivorship event, and they both came up to me and just said, hey, you know what we talked about in clinic? And I knew exactly what they were talking about. And they said, it's way better. We looked at some resources, we looked at some books, we got some help. And it was just lovely to see this older couple enjoying their intimacy back together again. Some of the things that they did, he got some physical therapy, some pelvic floor physical therapy that helped him with his erectile issues, also saw urology, and got on some medication that was able to be helpful. And just simply their communication together and being willing to try some new things made a huge difference for them. So one more patient story for you is this about not feeling sexy during cancer treatment, stressed, out of control, like your body is not your own, and then also those hormone changes. And what comes to mind for me when I think about this is a younger woman, a woman in her 30s, mid-30s, who kind of got thrown into that sudden menopause thing after breast cancer treatment. And she was on hormone suppression therapy, no libido, mood swings, hot flashes, all of those fun and exciting things, on top of having teenage kids and trying to get back to work after cancer treatment, and just feeling a little bit out of control all over the place. We sat down in her survivorship visit and talked about what were the things she could control and what were some of the things that she'd like to do. One of the things that really was bugging her was the vaginal dryness, and she had a lot of just discomfort, itching, some pain with attempting intercourse, so just had kind of thrown that off the docket completely. And we talked through a number of things, getting some counseling, asking for some reduced work hours and not feeling so guilty about that, being able to schedule some date nights, doing vaginal moisturizer and some different lubrication with sexual touch that helped. We went through a number of different things like this, including even, using a vibrator herself to kind of get back to her own body, and then being able to work with her partner to say, this touch feels better than that touch now. And so again, that communication piece was really important. But again, in follow-up, this got much better with some overt effort at making it better, but there was significant improvement. So the point of this is be your own advocate. Do ask, do tell. Bring it up. Even if your voice shakes, even if you blush, even if you feel like you want to climb under the table, or even if you need to write it down and slide it across the table and not actually say the words, that's okay. If you don't ask your questions of your healthcare team, they won't know you have them. It's possible that you have this primo healthcare provider that's going to ask you these questions, that they're going to do that of their own volition. But you know what? They all are willing to talk to you about this if you bring it up. Also talk to your partner, but I'm going to say choose a neutral time and setting to do that. In the midst of an intimate moment, a sexual moment that maybe isn't going well and everybody's feelings are all out there on the surface, That is not a neutral time and setting. Um, also, when you have, like 5 minutes before you have to be out the door, and say, hey, by the way, don't like how sex is going right now. Okay, gotta run. That also is not a good choice. But choose a neutral time and setting. Maybe a time where there's an hour and you were thinking that you were going to turn on the TV and watch a show. Say, you know what, instead of that, could we talk about something that's really been on my mind and on my heart? And try and use gentle, kind words, non-blaming. Be kind to yourself, but bring it up, because it's very, very likely that talking about this will help. Some other things, the rest of the slide, right? You can talk about this with other cancer survivors or in your cancer support group. Or if you've got a good friend or a neighbor who's gone through cancer or another big medical issue, you can say, so can I ask you something kind of embarrassing? And you're going to find that you're not alone in this. And somebody else may say, wow, I tried this. It worked great. I talked to this person. And in your support group, there might be other people who are afraid to bring it up. And when you bring it up, they have things they can contribute or things they can learn. You can seek professional help, and there is a broad band of professional help available for vaginal issues, pelvic issues, gynecology, urology. The urologists are the people who can help with things like frequent urinary tract infections or bowel problems. Physical therapy, specifically, you can do regular physical therapy for stamina, endurance, and things. You can also do pelvic floor physical therapy that can help a lot with pelvic pain or fear of pelvic pain. Pain management, if you do have the hypersensitivity. And mental health counseling that can be just for yourself or as a couples counseling, whatever is the right combination for you. You can find books and other resources, and I know at the end of this talk, Katarina has some recommendations for you for that. There's web searches, but I want you to do websites that end with .org. And the .org usually means that that is an institution, like scca.org, right? Or fredhutch.org that are reliable, that are not going to lead you down a merry path. We don't want you looking for those quick fixes in the tabloids and general web browsing that can be pretty alarming. So stick with the reliable things. And then remember that physical wellness and mental wellness go hand in hand. If you are feeling depressed or anxious or not mentally well, it's really hard to feel very physically well. Same thing goes too if you're exercising, getting enough sleep, maybe limiting alcohol intake, having healthy foods, healthy diet. All of those things can kind of help your mental wellness and your relationships as well. And then it sounds so silly, but practice being kind to yourself, being kind to others around you. And that getting used to that kindness actually does really increase intimacy very much. And that intimacy, it matters too. Really, we don't often start off by just going like, hubba hubba, let's jump in bed and, sex will be terrific. You can start with the intimacy and build, holding hands, back rubs, foot rubs, my favorite. Spend time doing things that you have a favorite movie that you've laughed about 1,000 times, and do that again. It's like, oh, right, it's fun to laugh together or take a walk or look through family photos, things like that. Doing projects together, certainly, not particularly thinking that that's super sexual, but it kind of reminds you that you like each other. And also that can be true even with dating. Build some trust, build some romance. Plan a real simple date or a getaway. Oftentimes during cancer treatment and afterwards, it's really like, oh, we've got an appointment to go to. We've got home and rest. Oh, we've got to get the groceries. We've got to this. We've got to that. Oh my gosh. And do something completely. Hey, let's just go get an ice cream cone together. Something really simple that's just for fun. That's off the beaten track, or maybe even a whole getaway. Be realistic and honest. Be specific about what you want. And that's something that in that self-advocacy, I want more sex. That, but being really, really specific. I would really like it if I got a good night kiss. That real specific, and build from there. You really have to kind of create those opportunities. And really these last two, these simple things that can be the hardest, but start us on that firm base and that scaffolding of creating that intimacy, sexuality, and sex after cancer. Practice positive self-talk. We are always harder on ourselves than we are on anybody else, I think, but practice that positive self-talk. Looking pretty good today. Hey, I'm feeling okay. Yeah, I'm a pretty okay person to be around. And then gratitude. Thank you for taking out the garbage. Thank you for getting me to my appointment. Thank you for letting me go to bed early. Thank you for doing the dishes. That makes a big difference. And so now I'd like to turn this over to Katerina, and thank you so much for your time.
Thank you, Leslie. So these are some books just to get you started. Not just books, but also a website, a free online PDF booklet as well. These books really complement Leslie's talk today, especially as we're talking about starting communication with your partner or significant other, or if you're curious yourself as a patient. So Ann Katz has two wonderful books, Man, Cancer, Sex, and Woman, Cancer, Sex. Both of her books describe the changes in sexuality and common side effects, as Leslie reviewed today, and how either patient or their partners can resolve these issues in a sensitive and realistic manner. Not necessarily resolve per se. I mean, hopefully that's the case, but starting the conversation is really important. As Leslie's mentioned, do ask, do tell. And everything nobody tells you about cancer treatment was also taken from interviews of women who've been under cancer treatment themselves, ranging from A to Z of different topics, where maybe H stands for hot flashes and L stands for laughter. So it really covers a lot with intimacy, sexuality, and conversation. And as also Leslie mentioned, going to a safe and accredited website using .org, American Cancer Society covers a really great section on fertility and sexual side effects. So these are just a few resources to help you get started. I would also like to share some locations and shops that you can go look for intimacy products. First and foremost is Shine Retail Store. That is an SCCA store that is located near REI around South Lake Union. They have a wonderful selection of oncology special products, from mastectomy fittings, wig fittings, to just lotions, hand creams, really lovely clothing as well. And they do address and have some sexual products as well. Shebop in Portland, Oregon, and Babeland in Seattle, Washington. If you're looking for more reading material, again, for accredited reading material online or with, in hand, in print, we do have that for you. We could share. If you'd like to learn more about Green Labyrinth and Leslie Heron's work, please contact us. Below, I have our Patient and Family Resource Center contact information, our email address, our phone number. We're really excited to share more with you about this topic. And lastly, whether you're a patient at Seattle Cancer Care Alliance or any patient around the Seattle area, you do have access to our Seattle Cancer Care Fred Hutch Survivorship Clinic. It is never too late or too early to talk about your sexual health, intimacy, during treatment, after treatment, and beyond. Please contact us to learn more about our survivorship clinic. We're happy to share how you can start the conversation with your provider or someone like Leslie who can help. So thank you so much for joining and tuning in today.